If you've been told you need antibiotics and a CT scan every time your diverticulitis flares up, that guidance may not be as automatic as it once was. New research around uncomplicated diverticulitis is quietly changing how doctors think about both diagnosis and treatment. I'm Dr. Kenny, IFM certified functional medicine practitioner, and part of my work is helping to spread the news of updates just like this without the noise. So let's walk through what actually shifted with these guidelines and what it means in practical terms. And if you appreciate gut-related content like this, go ahead and give it the like button and I'll make more just like it. When diverticulitis comes up in conversation, the focus usually jumps right to treatment, and rightly so. It's painful and uncomfortable. Do you need antibiotics? Do you need imaging? What foods to avoid or gravitate towards? But underneath those questions is a deeper one running through, because millions of people have diverticulosis, or small outpouches in the colon wall, and most of them never switch into the inflammatory state diverticulitis. So the real mystery here and the nuance isn't just with treating diverticulitis when it flares up. It's understanding why people live with these pockets for decades without problems, while others have recurrent flare-ups again and again. And when we start to clue into the physiology behind this difference, diverticulitis begins to look more like a pattern that occurs when multiple systems of the body converge. Understanding that shift is what is driving the changes to diagnosis and treatment. Before we talk about treatment, let's dive into the difference between diverticulosis and diverticulitis a little bit more. Again, diverticulitis simply means the outpouchings in the colon wall. These pouches are called diverticula. The way that these form is that over time, pressure inside of the colon and against the wall push outward on weaker spots, allowing these small pockets to form. And again, this is extremely common when it comes to the variation in anatomy. Many adults develop diverticulosis and never really realize it because it doesn't come with symptoms. Diverticulitis is something very different. Diverticulitis occurs when one or more of these diverticula become inflamed, the ending itis. Sometimes infection plays a role, sometimes it's predominantly an inflammatory experience. Often it's a combination of both. But the key idea is this experience, diverticulitis, cannot exist without inflammation. And that distinction is important because it means the pouches being present by themselves isn't the issue. And once we hone on that difference, another question probably is arising. What determines whether those pockets stay quiet or become inflamed? Because the answer is almost certainly more complex than the old explanation, which was that a seed or a piece of food got stuck in one of the pouches. And that assumption is exactly what the emerging research has begun to challenge in a big way. Once diverticulitis has been diagnosed, the approach to treating it has been fairly predictable. Antibiotics, sometimes imaging, and a period of dietary modification, usually a liquid diet, while the colon calms down. And for many years, that approach made a lot of sense. If diverticulitis was assumed to be primarily driven by a bacterial infection, then naturally antibiotics became the first line of treatment. But over the past decade or so, researchers have begun asking a different question. What if not every case of diverticulitis is driven by an infection? What if the inflammation itself plays a much larger role than we originally thought? That question led to the development of several clinical trials that compared two groups of patients with uncomplicated diverticulitis. One group received antibiotics, the traditional line of treatment, and the other received supportive care without antibiotics. And the results were surprising, to say the least. A larger systematic review published in 2023 analyzed a compilation of these studies that were asking that exact question. What these researchers found was that outcomes such as recovery time, complication rates, and recurrence were similar in both treatment groups. That means whether or not antibiotics were used. In other words, just as many people without antibiotics recovered. This doesn't mean that antibiotics are no longer important or useful, especially in specific subpopulations. They remain very important in complicated diverticulitis, in patients with immune system suppression, and with persisting or worsening symptoms. But that newer data is suggesting something important, that diverticulitis is not always a bacterial infection and that antibiotics are not always required. That shift in understanding is one reason the treatment guidelines are beginning to evolve again. Many doctors are becoming more selective when antibiotics are used. And so our next natural question is that if infection isn't always the main driver, what actually triggers the inflammation in the first place? And to explore that question, we need to zoom out even further and look at some concepts that have been receiving attention in the gut health world for the last decade. And that is the ecosystem inside of your gut called the microbiome. Because the microbiome may play a much larger role than we originally thought in the development of diverticulitis. The term microbiome refers to the dynamic and complex ecosystem that is present in your digestive tract, all the way from the mouth out. These microbes help to regulate digestion, produce some of our vitamins, and help to regulate both the immune and inflammatory balance in the gut. In a balanced microbiome, many of these organisms have protective functions or benefits that help to protect the function of the colon. One of the most important compounds is butyrate. Butyrate is a short-chain fatty acid, or a small fatty acid that has anti-inflammatory benefits and serves as the main fuel source for your colon cells. Butyrate is produced by pretty much a magical process that takes place when certain gut bacteria ferment the fibers that we consume in plants, fruits, vegetables, legumes, grains, etc. It takes the fiber and essentially turns it into fat. Aside from inflammatory balance and fuel, butyrate also protects the integrity of the gut lining. When this butyrate system is functioning well, the lining and the immune barrier of the colon tends to be more resilient. But when the microbiome is disrupted in a big way, sometimes called dysbiosis generally, the environment inside of the colon can shift toward more inflammatory signaling. And researchers have begun investigating if this process indeed plays a role in the development of diverticulitis. A specific systematic review published in 2023 looked at the microbiomes of individuals with diverticulitis to try and tease out some patterns. And two of the most common findings were reduced levels of butyrate, as well as other shifts in the microbiome populations. What this suggests is that the microbial ecosystem may influence the integrity or the resilience of the gut in diverticular disease. It doesn't mean that the microbiome is the only player, because nothing in human physiology is ever that black and white in most cases. But it does suggest that the balance of microbes play a role in whether or not these diverticula stay quiet or become inflamed. Since the pockets are a piece of the equation, what else inside the colon might contribute to their formation? Another important factor involves the pressure and the movement of waste through the colon itself. And so we're going to shift our focus to the mechanical pressure created inside the colon. It's important to remember that your colon is not a passive tube. It's constantly coordinating waves of movement that push waste through the digestive tract. This process is called motility. When your motility is rhythmic and balanced, pressure inside the colon stays relatively well distributed. But if not, pressure that builds up in certain areas can develop those outpouches. A great analogy here is to imagine a garden hose and its pressure. If the wall of the hose is strong and without any kinds of disruptions, the pressure is evenly distributed and water flows normally through it. But if certain areas of the hose are thinner, the pressure builds up in those areas. Regular bowel movements are one of the most important things when it comes to protecting the pressure along your digestive tract. Regular being between 1 and 3 times a day, ideally stimulated after you eat a meal. We've talked the mechanical pressure and the microbiome, and the development of diverticulitis likely includes more underlying causes. One of the most important factors that researchers are also turning into is your overall inflammatory environment. Because inflammation in the colon doesn't happen in isolation. It's influenced by signals coming from the rest of the body as well. Inflammation is a normal and natural part of your immune system's response. It helps the body to react and repair to potential injuries or microbial threats. But when low-grade inflammation becomes chronic for long periods of time throughout the body, the immune system can become more reactive in tissues that are already vulnerable to inflammation. And the colon is one such site. Researchers that focus on diverticular disease have increasingly explored the connection between the development of diverticulitis and metabolic inflammation. Metabolic inflammation refers to the low-grade inflammatory signaling that occurs in circumstances such as insulin resistance, type 2 diabetes, and certain dietary patterns. A large cohort study published in 2022 observed cohorts of people with diverticular disease and found that metabolic factors such as obesity and insulin resistance were associated with a higher likelihood of diverticulitis complications. Bigger picture, this suggests that diverticulitis is not just about what happens inside the pocket that develops in the colon. It may be influenced by the overall inflammatory tone or the inflammatory load on the body. Over time, these lifestyle factors or environmental exposures that increase inflammatory signaling can make certain tissues more reactive over time. So as you can see, there's a lot of layers that influence the process of diverticulitis. But what determines how the immune system within the gut itself responds? To answer that, we need to go a layer even deeper that often gets overlooked in discussions about diverticulitis. And that is the immune barrier that is the intestinal wall. Because the colon is not just a digestive and waste transport organ. It's also the most active immune interface in our entire body. A large portion of your immune system is positioned along the entire digestive tract. And that immune system presence is constantly monitoring whether what enters it is either friend or foe. One of the components of this defense system that I like to draw attention to is called secretory IgA. Secretory IgA is an antibody that is produced by the immune system and lives on the lining of our digestive and respiratory tracts. This antibody helps to regulate this interaction between self and non-self. You can think of them as the bouncers of the club that determine whether or not something is allowed to be absorbed through the digestive tract. When secretory IgA is in high enough amounts and well-functioning, the immune system tends to maintain a more stable relationship with the microbiome, with the foods that enter the digestive tract, and even with toxins. But when it becomes under or overperforming, immune responses in the gut can be more reactive or underwhelming to combat the threats. Another important marker to consider is calprotectin. Calprotectin is a protein that is released by cells of the digestive tract when inflammation is present. Elevated levels can clue you into the fact that immune activity is increasing inside of the gut. And these markers often coincide with whether or not those diverticular pockets remain quiet for years or become inflamed and show up as diverticulitis. And there's another system that influences how these immune and digestive processes behave. That is your nervous system, because both digestion and your immune system resilience is deeply connected and inseparable from the body's stress response and nervous system pathways. And we have a name for this connection, which is the gut-brain axis. This communication network is a two-way highway that allows for communication and signaling to take place between the nervous system and the gut, and vice versa. One of the ways that these signals influence digestion is through motility and immune regulation. You've probably heard of the rest and digest part of the nervous system, but you can also add the word repair in there, which is incredibly important when it comes to inflammation. When this part of the nervous system is supported and in a balanced state, digestion tends to function rhythmically, blood flow to the digestive tract is strong, motility patterns remain coordinated, and immune signaling in the gut tends to be more regulated. But when the body is in more of a prolonged stress state, priorities begin to shift. Digestion, motility, and immune system strength become less of a priority in these circumstances. This doesn't mean that stress alone causes diverticulitis, but it is one of the systems that influences each of the mechanisms that we've already explored. So when you step back and look at all of these underlying mechanisms together, diverticulitis begins to look way less like a single cause condition and more like a pattern that is shaped by multiple underlying systems. And so diverticulitis management is evolving accordingly. So if diverticulitis is influenced by inflammation, the microbiome, and the gut's immune barrier, The next question becomes, how can we support that delicate barrier within our gut? This video on your screen explores that exact physiology and why the health of your intestinal barrier matters far beyond a single digestive condition. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next video.